Welcome to part 3 of our 3-part series talking about cochlear implants. Today we're going to focus on all the follow-up care.
Hi, I'm Dr. Michael Squires.
And I'm Dr. Carly Squires.
And this is Dr. Squires Squared.
This is a channel where we have candid and casual conversations about anything audiology.
And if you are not sure what audiology is, make sure to like and subscribe to the channel. Get our notifications by hitting the bell. We're going to tell you all about it. All right, so today is part 3, the last part of our cochlear implant series. And today we're really going to talk about everything that happens after surgery, what all that follow-up care looks like. So just to set the tone, let's say that we've already had surgery, we've been back to the physician, everything has been cleared, we're ready for that cochlear implant to be activated by the audiologist and turned on for the very first time.
And I think if you were going through this process, we would be setting you up for realistic expectations, knowing what to expect individually per patient, because everyone's experience is different. But I think the underlying message here is just that a cochlear implant is not the same thing as a hearing aid.
Right.
If this patient has worn hearing aids before. It's a different way that the brain hears, so you want to be prepared for a totally different way of hearing, but also that on day 1 and day 2 and even 1 month and the whole first year, really, what we're doing is working our way up to your full potential of hearing. And so we wouldn't expect things to be, perfect at that initial point, or really, it's going to take some time. So we want to talk about what that looks like today.
Right. I always talk to my patients, especially on that first day when we activate that cochlear implant, about what they can expect. And really what they can expect is the absolute unexpected. Expect the unexpected is what they say. It's not like a hearing aid, so the sound is very different. And I think the importance within that first year, like Carly is saying, is retraining the brain to establish a new normal. And to develop new memories around the auditory interaction with our lives, so that the brain actually knows what that means instead of it just sounding completely different and weird.
Right, and really what that takes is, number 1, it's going to take quite a few follow-up appointments.
Right.
And in our clinic, we do have a certain protocol that we follow in terms of how many visits, when you come in, what we're doing at those visits. Every office is different, but essentially the thing to know is, in that first year especially, you're going to be seen for quite a bit of appointments, and that's a good thing. So where that seems like a hassle, that's a great thing, because that means you're coming in, we're talking through everything, we're making changes, and we're just trying to help you acclimate to that new way of hearing. And on the other side of that, we want to talk a little bit about that you are going to be asked to do some homework, do some things on your own too.
Yeah, for sure. It's so important. So just what we said a minute ago, unlike hearing aids, when in many cases you're taking an acoustic signal and changing it into a different acoustic signal. Right now, with a cochlear implant, we're taking an acoustic signal and turning it into an electrical signal. So that transition means that there's a lot of differences when it gets to the brain. So the homework that we give you are things that we refer to as oral or auditory rehabilitation. It's some of the things that many audiologists or speech language therapists will do with you on a professional level, but there are activities that you can do at home, like listening to books on tape, or going for a listening walk, or practicing on the telephone, yeah, exactly, or with music, and just gradually working up in the complexity of that homework or those activities. And what that does is it allows the brain to build memories around those different types of sounds, so that eventually it becomes much easier. We have wonderful examples of patients who have gone from an inability to hear and understand, and I mean, I'm talking like 0% ability to understand speech, that a year or 2 later are in the 90th percentile. They're on our speech testing, they're in the 90, 96, 99% understanding, and it's because they worked really, really hard. On the other side of that, we have patients that start in that low percentage range, which qualifies them for the cochlear implant, but they don't do their homework, and they're their full potential is never really reached because of that.
Right. And I think it's also important to touch on the fact that and I'm sure you've been asked this too, I've had patients ask me, all right, Dr. Squires, what do you think how likely is it that I'm going to do well? Or how well do you think I'm going to do with a cochlear implant? And that's really difficult to predict because there are so many factors. But this is just hearkening back to this whole process that we've talked about, where you're going to go through so many different tests and measures to see if this is the best option for you, so that by the time you would be scheduled for a surgery, you have seen an audiologist, an ear, nose, and throat physician for multiple appointments each, really taking a good look at your individual situation to make sure this is the correct option for you. And then again, setting those realistic expectations for the follow-up care to make sure that you realize that there's a part that we have to do, but there's also just as much homework or work that you have to do on your own to make sure you get to that full potential.
All right, guys, so to summarize what we've been talking about through this whole series, we started off talking about what cochlear implants are and kind of how they work and what is different than a traditional hearing aid. We moved on to talking about the process of cochlear implant candidacy and determining whether or not that's going to be a good fit for you, or if maybe traditional hearing aids would be a better option. And then in this video, we've talked a little bit more about the follow-up care. So from the very beginning, all the way through that first year, it's very appointment intensive, but it's a good thing because we have to move and adjust kind of the plan of care depending on what's happening in the moment. Cochlear implants are very dependent on what's happening with the use of those cochlear implants. Again, totally different than how a hearing aid works and operates. So we hope that you found that this is educational. We hope that you found some useful information in here. If you are considering a cochlear implant appointment to determine candidacy, let us know. We can kind of help you prepare for that. If you're local, we can help you with that appointment. But the thing to remember is, and this goes with anything with hearing, I think, and you can kind of weigh in here, putting in the work and putting in the exercises at home, that extra rehabilitative step with that homework, and ask your providers to help give you some of that information or see if they have those services available. But putting in that work really, really makes the difference in the outcomes on the other end.
Absolutely. I mean, and a really good analogy is just when you think about your physical fitness and working out. A lot of us don't like to do that, but if you put the work in, you're going to see the results. And it's the same way when you're rehabilitating the brain and the auditory system.
Yep. So if you guys have any questions about what we've talked about in this series, please give us a call at the office, 304-428-2403, or shoot us an email at info@hearwv.com.
All right. I also want to say, at the time this is being filmed, we just celebrated our 6th wedding anniversary yesterday.
She hasn't killed me yet.
No, so I just want to say happy anniversary.
Thank you very much.
And we matched today.
Yeah, we did that on purpose. So for that, make sure to like and subscribe, keep up with the channel, and we'll catch you next time.
Thanks.
See ya.